Intraoperative radiation therapy, IORT, is an important and emerging form of partial breast radiation therapy being utilized in the treatment of breast cancer. Now, most of the experience has actually come from Europe, in countries like Germany, where it's used to do what's called the boost. In countries like Italy, where there's been a large experience with what's called single fraction intraoperative radiation therapy, one shot. There's been a worldwide study called the Target study that's also been published that has involved multiple countries. The two major forms, or the two major energy sources for intraoperative radiation therapy, are electrons, which has the longest track record, and then X-ray. And these are two different types of mobile units that are used around the world. Now, the major use of IORT in breast cancer are in two sets of circumstances. One, a single fraction, meaning instead of 6 weeks of radiation therapy, one dose of radiation therapy is given at the time of surgery, and you're all done. And that's called single fraction. And that's typically a dose in the terms that the radiation oncologists talk about of 21 gray. The other use of IORT at the time of breast cancer surgery is what's called the boost. Now, what is that? Traditionally, after whole breast radiation therapy of approximately 5 weeks, the last week was called the boost, where you were just focusing on the area where the cancer had originally been. The reason for this is that, again, 85, perhaps 90% of the time, if the cancer is going to come back in the treated breast, it's usually right in the neighborhood where the original cancer was. So the concept of the boost was to help lower that incidence. And indeed, this is the case in published literature. One of the larger experiences with doing the boost, followed by whole breast radiation therapy, is in Salzburg, Austria. I've had the opportunity to visit that site, and they report a 0.1% in-breast recurrence rate combining the boost with whole breast radiation therapy. At my own particular hospital, St. Joseph Hospital in Orange, California, we've got now, close to a 3-year experience of doing the boost intraoperatively, followed by whole breast radiation therapy. A year or so ago, we then launched a protocol that hopefully will be in cooperation with our colleagues in Europe as well, where we do the boost at the time of the lumpectomy, followed then by a shortened form of radiation therapy called hypofraction. And then finally, at my institution and at a few other locations in the United States, we now have protocols for a single fraction of electron IORT treatment at the time of the lumpectomy. I've done another video about the American Society of Radiation Oncology's guidelines for who are the appropriate patients for partial breast radiation therapy. Please take a look at that video as well. But my belief is that IORT is here to stay as long as we properly select the patients. The Mobetron is a mobile, self-shielding linear accelerator used to deliver intraoperative electron radiation therapy for the treatment of breast and other forms of cancer. To learn more about this exciting and cutting-edge technology, please go to intraoperativemedical.com.